To pick up with the other two plexi, we're looking at the lumbar plexus and the sacral plexus. A lot of times it's referred to as the lumbosacral plexus as one big plexus. So if you're looking at the lumbar plexus itself, looking at about lumbar 1 through lumbar 4 as the spinal nerves. Now in this case, abdominal wall and psoas muscle. So I think psoas major and minor. And it deals a little bit with the innervation down in the thigh as well. So we're looking at abdominal and lower. But then if we switch over to the sacral plexus, it picks up at that lumbar 4 and goes through sacral 4. So the lumbar 4 spinal nerve all the way through sacral 4 spinal nerve. In this case, dealing with the buttocks, looking at lower limbs, pelvic, and perineum. So again, similar areas and moving just a little bit lower down. So if we look at where they are, this is your lumbar plexus. The first 4 of the spinal nerves, lumbar 1 through 4. And you can see how it's forming this web-like structure. But now if you look at the sacral plexus picks up about the same area, heads down to sacral 4, even sacral 5 sometimes. But you can notice how when it comes out, it's the same web-like structure. But because if you see they're so close together, a lot of times they're simply called the lumbosacral plexus because all the fibers are meshing, all coming together. They're all intertwining in one area. So that's the lumbar plexus. The sacral plexus, a lot of times simply called the lumbosacral plexus. All right, so a few nerves that come out of the lumbosacral plexus. Some nerves you probably have heard of, other ones you might not have heard of. First one up is the genitofemoral nerve. Now the genitofemoral nerve is dealing with sensations from the anterior thigh, scrotum, or labia majora. Obviously scrotum male, labia majora female. But beside those two genital region areas, looking at the anterior thigh. So if you were to take your hand and kind of pat your thigh, you're looking at sensation from the genitofemoral. All right, genitofemoral. Next up is the lateral femoral cutaneous. Now this one, lateral thigh. So while the genitofemoral was the anterior thigh and genitalia, looking at that aspect, this one, the lateral femoral cutaneous, is out on the lateral side of the thigh. So same idea, just moving out a little further away. Then just the regular old femoral nerve, which you might have heard of this one before, especially back in the the muscle units. Innervates the thigh muscles, so we're heading down into the thigh. We're also dealing with anterior thigh sensation, medial leg, and foot. So if you're, again, in the front of the thigh, you're having more sensation there, as well as getting down into the foot region. So heading a little lower down. So we have both motor and sensory to keep track of for the femoral nerve. Now, these specific anterior thigh muscles, we're not worried about at this point. Back in the muscle chapter we did, but for now, just know anterior thigh muscles is fine. The sciatic nerve. Now, I'm willing to bet you might have heard this one before, sciatic nerve, sciatica, or a pinched sciatic nerve. The sciatic nerve itself is actually made up of the tibial and fibular nerves. So really, it starts off as the sciatic, then branches pretty quickly into the tibial as well as the common fibular nerves. Let's start with the tibial. The tibial nerve is going to deal with hamstrings, posterior leg, and intrinsic foot. So hamstring, think back of the leg. Makes sense, then posterior leg muscles going down, as well as the intrinsic muscle of the foot, intrinsic inside. So we're dealing with inside of the foot. Sensation-wise, which means sensory is coming back up, again, posterior leg, sole of the foot, knee, and foot joints. Makes sense if you're talking about posterior leg for innervation of the muscles for movement, sensation comes from the same spot. Then you bring up the sole of the foot, which if you do the intrinsic muscle of the foot, same spot. And then the knee joint and the foot joint. All this is through just the tibial portion that's branching off the sciatic nerve. The other branch, which is your common fibular nerve. The common fibular nerve, biceps femoris. Remember, biceps is not just in your arm. Biceps femoris is in the leg. Anterior and lateral muscles of your leg, as well as the extensors of the foot. So we have a whole mixture of pieces and parts here. Again, just like the tibial nerve, this has a very long reaching all the way down your leg. Sensation-wise, lateral calf and dorsal of the foot. So looking at back of the lower leg, kind of out to the lateral side, and then dorsum of the foot. As far as the common fibular nerve, which comes off the sciatic nerve. Then we have the saphenous nerve. Now this one you might not have heard of, maybe you have. But we'll get to the term again, saphenous, also in the blood vessels in AP2. But for now, the saphenous nerve is the skin of the medial leg, so coming down the inside of your leg, as well as the foot and knee joints. So it's down the middle or inside the leg, the medial portion, and getting down to the foot and knee joint a little bit. If you notice, there's overlap in some of the sensation here. You're not going to have simply one single nerve carrying sensation from every spot. Sometimes you get some overlap, where two nerves have similar overlapping areas. The pudendal nerve. Now, the pudendal nerve is innervating the perineum. Perineum is the space between the anal canal and the genitalia, whether it's the penis in the male or vagina in the female. Basically, this one's helping out to facilitate the erection as well as voluntary urination control. And yes, erection is both a male and female characteristic. So that is in both genders here. Sensations coming from the skin of the penis, obviously on the male side there, as well as the scrotum. Female side looking at clitoris, labia majora, and labia minora. So the pudendal nerve makes sense since it's in between the anal canal and the genitalia. Also has sensations coming from the genitalia itself. The pudendal nerve. So that is the lumbosacral plexus and selected nerves that come off of that lumbosacral plexus. Now, is it every nerve? No, but this is a selected ones that kind of are more important at certain aspects that we're covering.